Hello and welcome everyone to chapter 33, OB and neonatal care, page 1182. Let's get started on our introduction, and we'll see that most deliveries occur in the hospital with doctors and nurses in attendance. Occasionally, the pregnant woman is unable to get to a hospital, and that's where we come in. Then you must decide if you want to assist delivery on scene or transport the patient to the hospital. All right, moving on down to anatomy and physiology of the female reproductive system. The ovaries are two glands, one on each side of uterus or the womb, that are similar in function to the male testes. Each ovary contains thousands of follicles, and each follicle contains an egg. Ovulation occurs approximately 2 weeks prior to menstruation, and if fertilized, the egg implants in the endometrium, the lining of the inside of the uterus. So once a month, the lining will detach itself from the uterus. Then an egg leaves the ovary and travels through one of the fallopian tubes into the uterus. If the egg is not fertilized within 36 to 48 hours after it's been released, it will die and the lining is shed as menstrual flow. The fallopian tubes extend out laterally from the uterus with one tube associated with each ovary. Fertilization, which is when a sperm meets the egg, usually occurs when the egg is inside the fallopian tube. A fertilized egg then continues to the uterus where it develops into an embryo. All right, looking on down towards the bottom of page 1183, you see the word highlight embryo and fetus. The embryo is a stage 0 to 10 weeks after fertilization, and the fetus is a stage from 10 weeks to delivery. Go ahead and highlight that because you will see that again. Also highlight where it says the uterus is a muscular organ that encloses and protects the developing fetus. All right, page 1184. You'll see at the bottom of page 884 where it says the placenta is a disc-shaped structure attached to the uterine wall that provides nourishment for the fetus. It also keeps circulation of the woman and fetus separated but allows substance to pass through them. So anything ingested by a pregnant woman has the potential to affect the fetus. And you'll see right there next to the word figure 32, it consists of two layers of cells keeping the circulation of the woman and fetus separated, but allowing nutrients, oxygen, waste, carbon dioxide, and unfortunately many toxins and medications to pass between the fetus and the woman. Go ahead and highlight that. All right, the umbilical cord, which attaches the baby to the placenta, connects the woman and fetus through the placenta. So a good thing to remember is that the umbilical cord carries oxygenated blood from the placenta to the heart of the fetus, and the umbilical arteries carry deoxygenated blood from the heart to the fetus of the placenta. All right, looking on page 1185, the fetus develops inside a fluid-filled bag-like membrane called the amniotic sac. When a woman says that her water has broken, that is what breaks. And it contains about 500 to 1,000 milliliters of amniotic fluid, which helps insulate and protect a floating fetus. And that is right there above where it says normal changes in pregnancy, about the middle paragraph. Go ahead and highlight that. All right, moving on down to normal changes in pregnancy, page 1185. During pregnancy, other body systems undergo changes. The primary system involved with these changes are the respiratory, cardiovascular, and the musculoskeletal system. In the reproductive system, hormone levels increase to support fetal development and prepare the body for childbirth. This puts pregnant women at increased risk for complications from trauma, bleeding, and other medical conditions. The uterus is displaced out of its normally well-protected position within the pelvic area. This is what increases the chance of direct fetal injury and trauma. All right, and during the second trimester of pregnancy, rapid Uterine growth occurs. As the uterus grows, it pushes up on the diaphragm, displacing it from the normal position. Respiratory capacity changes with increased respiratory rates and decreased minute volumes. Overall blood volume gradually increases throughout the pregnancy. The speed of clotting increases to protect against excessive bleeding during delivery, and cardiac output is significantly increased. All right, during the third trimester, there's an increased risk of vomiting and potential aspiration following trauma because of the changes that occur in the gastrointestinal tract. Changes in the cardiovascular system and increased demands of supporting the fetus significantly increase the workload of the heart. So weight gain during pregnancy is normal. The increased body weight will eventually challenge the heart and impact the musculoskeletal system, and increased hormones affect the musculoskeletal system by making the joints looser or less stable. And in the third trimester, changes in the body center of gravity increases the risk of slips and falls. All right, page 1186. Complications of pregnancy. Majority of pregnant women are healthy, but some may be ill when they conceive or become ill during pregnancy. Oxygen delivery during pregnancy poses no harm to the fetus. Diabetes. Diabetes can occur during pregnancy in many women who have not had diabetes previously. Gastrodiabetes resolves in most women after delivery, and the treatment is the same for any other patient with diabetes. All right, looking at hypertensive disorders, we have preeclampsia, or pregnancy-induced hypertension, can develop after the 20th week of gestation. It is characterized by the following signs and symptoms: severe hypertension, which is usually anything above 160 over 100, severe persistent headache, visual abnormalities such as seeing spots, blurred vision, or sensitive to light. They also can have swelling in their hands and feet, which we know is edema, and anxiety. And something that you will need to know that I don't think is in your book, there are complications of preeclampsia. One is premature separation of the placenta. Number two is low birth weight in infants, and also pulmonary edema. All right, so then we have eclampsia. That is what happens when preeclampsia is not treated. It is characterized by seizures that occur as results of hypertension. So the way we treat seizures in the pregnant female, we lie the patient on her left side, maintain her airway, we're going to give them oxygen, and if vomiting occurs, we're going to suction the airway. We provide rapid transport, and we call for ALS intercept if available. All right, and so if you look underneath eclampsia, go ahead and highlight what I just read. So basically, one thing you need to know about eclampsia, preeclampsia, and eclampsia is preeclampsia is hypertension, and eclampsia is seizures. So remember that there's one word that separates those two, and that is seizures. All right, so also look right below that where it says transporting the patient on our left side can also prevent supine hypotension syndrome. Now, that is basically when the baby is putting pressure on the vena cava, resulting in hypertension. So don't ever forget, do not lay a pregnant female on her back. Women know this, and we should know that. All right, 1187, under bleeding. All right, let's look at ectopic pregnancy. When embryo develops outside the uterus, most often in a fallopian tube, that is what's called ectopic pregnancy. In EMS, we have a rule, and it goes, if you're having a patient who is a female of childbearing age, which is usually 12 to 60 years old, and has unexplained abdominal pain, she is having an ectopic pregnancy, no matter what she says. Why? Because in EMS, we always look for life threats. And we look for things that will kill somebody. Just like if a person's saying they're having chest pain, there could be a million things that they could be having, but we treat that as they are having MI. So again, any female who is having unexplained abdominal pain, until it's ruled out, you treat them as they're having an ectopic pregnancy. The leading cause of maternal death in the first trimester is internal bleeding into the abdomen, which follows the rupture of an ectopic pregnancy. Consider the possibility of an ectopic pregnancy in a woman who has missed a menstrual cycle. So you always want to ask about her last menstrual cycle, and a complaint of sudden, severe, and usually unilateral pain in the lower abdomen. All right. Hemorrhage from the vagina that occurs before labor begins may be very serious. In early pregnancy may be a sign of a spontaneous abortion or a miscarriage. In the later stages of pregnancy, vaginal hemorrhage may indicate, number one, abrupto placenta, and that is the placenta separates prematurely from the wall of the uterus, most commonly caused by hypertension or trauma. They will report severe pain. All right, then we have placenta previa, which is the placenta develops over and covers the cervix. The hallmark sign of placenta previa is painless vaginal bleeding during the third trimester. So the difference between the two, abrupto placenta, they will have severe pain. And placenta previa, the woman will have no pain but will be bleeding. All right, moving on down to abortion. But before we do, go ahead and highlight the definition of abrupto placenta on page 1187 and the definition of placenta previa on page 1188. And also under placenta previa, highlight where it says often without significant pain. All right, so abortion, page 1188, passage of the fetus and placenta for 20 weeks is called an abortion. Abortions may be spontaneous, which is miscarriage, or induced. The most serious complication of bleeding and infection. If the woman is in shock, transport her immediately to the hospital. All right, under abuse, pregnant women have an increased chance of being victims of domestic violence and abuse. Abuse during pregnancy increases the chance of spontaneous abortion, premature delivery, and low birth rate. The woman's at risk from bleeding, infection, and uterine rupture, so you want to pay close attention to the environment of any signs of abuse. All right, on substance abuse, page 1189. The effects of the addiction of the fetus include prematurity, low birth weight, severe respiratory distress, and death. Fetal alcohol syndrome describes the conditions of infants born to women who have abused alcohol. If you are called to handle the delivery of a drug or alcohol-induced woman, pay special attention to your own safety. Clues that you are dealing with an addicted patient may include the presence of drug paraphernalia, empty wine or liquor bottles, and statements made by the family or bystanders or by the patient herself. The newborn may need immediate resuscitations. And newborns they can be born addicted to drugs and can go through withdrawals. All right, page 1189, special considerations for trauma and pregnancy. With a trauma call involving a pregnant woman, you have two patients to consider, the woman and the unborn fetus. All right, looking at the top of page 1189, where it says pregnant women have an increased amount of overall total blood volume and approximately 20% increase in the heart rate by the third trimester. And a pregnant trauma patient may experience a significant amount of blood loss before you detect signs of shock. Go ahead and highlight that. And also, the fetus may be in trouble well before signs of shock are present. So you want to be alert to additional concerns and ready to assess and manage the unique types of injuries when responding to a pregnant trauma patient. The uterus is especially vulnerable to penetrating trauma and blood injuries. A trauma injury to the patient to a pregnant uterus can be life-threatening to the woman and fetus because the uterus has a rich blood supply. In most cases, the only chance to save the fetus is to accurately resuscitate the woman. When a woman is involved in a motor vehicle crash or similarly violent mechanism injury, severe hemorrhage may result from injuries to the pregnant uterus. Trauma is a leading cause of abrupto placenta. So you want to suspect abrupto placenta when the mechanism of injury is blunt trauma to the abdomen and patient signs and symptoms are suggestive of shock. So common symptoms include vaginal bleeding and severe abdominal pain. Improper positioning of a seatbelt can result in injury to a pregnant woman and a fetus if they are involved in a motor vehicle crash. All right, turn over page 1190. Under maternal cardiac arrest, if a pregnant trauma patient goes into cardiac arrest, your focus is the same with any other patient that is in cardiac arrest. You want to perform CPR and provide transport to the hospital according to local protocols. If a woman is in her last month or two of pregnancy, compression may be applied a little bit higher on the sternum as usual. And under your assessment management, your focus is on assessment and the management of the woman. So you want to follow these guidelines when treating a pregnant trauma patient. You want to maintain open airway. You want and also be prepared for and anticipate vomiting. You want to administer high flow oxygen. You want to ensure adequate ventilation. Assess the circulation, of course, control any external bleeding. And transport considerations. You always want to transport the patient on her left side. All right, cultural values, consideration, and teenage pregnancy. I'm just going to leave that for your reading pleasure. And with that, I'm going to take a quick break and I'll be right back.